Um, hey, thank you for being here, Secretary Sebelius. And if every now and then I cut you off, I'm not being rude, but it's so valuable to have you here. I'm just trying to stay focused, and I apologize at the outset. I'll also say to my Democratic colleagues, Republicans do retain the savings, yes, 96% of them, but we put them back into Medicare as opposed to spending them on another entitlement. And I think that is the difference between the two of us. Secretary, I am a doctor who works in a hospital for the uninsured, but 20 to 50% of my patients have Medicaid. So I think it's fair to stipulate that when public insurance programs pay physicians below cost, then they really don't have access. It may be access in paper, but it's not access in power. Now, that said, Richard Foster currently estimates that under current law, in 9 years, Medicare will pay physicians below what they receive on average from Medicaid. Now, is it fair to accept with the given stipulation that will hurt access of Medicare patients to their physicians?
Well, I don't think there's any question, Congressman, that underpayment of any kind of provider certainly jeopardizes an adequate network, whether it's a private insurer or a public payer.
Now, if MedPAC, already knowing that under current law, physician reimbursement is cut by 21% in the near future, I'm sure you will agree that that would have a disastrous effect upon a patient like that.
In failing to fix the SGR.
And of course, part of the savings of SGR is into the $1 trillion of savings that the other side of the aisle claims for Obamacare. So I will tell you, as a patient that sees Medicaid patients at a hospital for the uninsured, when I read that this board has the limited ability to cut, but where they can cut is reimbursement to providers, I actually see that what we're really doing is effectively denying access. Now, I will also say that I've learned that rarely do government institutions admit that they are rationing, rather the queue gets longer. Would you disagree with that, or do you think I'm wrong?
Well, Congressman, I think that there's no question that, again, I think the Republican budget plan on Medicaid...
No, I'm really speaking about current law. I'm really speaking...
Medicaid
I see that you're pivoting here, but if we can stay on the current law as opposed to the pivot. Again, when we speak of a board which has limited ability to save money except by cutting payments to providers...
Well, that's not accurate, sir.
Okay, so it can also do Medicare Part A, and it can also do pharmacy coverage for dual eligible. But clearly, a significant portion of it is cutting payments to providers. Now, again, under current law, Medicare will be paying providers less than Medicaid per Richard Foster. It's well documented Medicaid patients have trouble gaining access. So where do we start in our analysis?
Well, again, I think that there are lots of opportunities in the delivery system where we are paying or overpaying for care that probably should never...
So if I may summarize, you're saying that there will be savings that will keep this mechanism from being gathered, that will keep this mechanism, this IPAB, this denial of care board from having to act. I will say parenthetically, the New England Journal of Medicine article, which I'm sure you're familiar with, shows that accountable care organizations have not saved money under the more favorable rules in which the pilot studies have been done. But going back to my point.
Some of them did, some didn't.
3 out of 10 did. 7 didn't. So coming back to the current law, coming back to current law, because we really can't say, oh, don't worry, if this works out, this will never happen. Let's just assume that it does happen. Again, if we decrease payment to providers, and we know from experience that will decrease access, does that not trouble you?
It does, which is why I think Congress carefully wrote into also the parameters for the Independent Payment Advisory Board that at every step along the way, provider access had to be part of their overall recommendations.
It has to be part
they
of the
make recommendations
coming back to this,
Congress.
Clearly, Medicaid, by law, has to provide access to for pregnant women and pediatrics. By law, they're supposed to pay adequately to give that access. And yet there's a recent New England Journal of Medicine study that shows that those with Medicaid or CHIP actually are more likely to be denied access to an appointment. In fact, 2/3 of the time they're denied such access. Doesn't that give us pause that despite that law, that they're guaranteed access, for the privately insured it's only 11% that you can't get an appointment, for the publicly insured it's 2/3?
again, IPAB has no authority to cut anything. They make recommendations.
And
secondly,
4/5
as you
of
know,
Congress
sir,
can
the
overturn it.
governors of various states set provider rates in their Medicaid programs. They are vastly different in Louisiana than they are in
This is
some
on
other
average,
states.
and I think New York Times is well documented in states as desperate as Louisiana and Michigan. That is the case. It's disingenuous to think otherwise, but that's okay. I'm out of time, and I yield back.
Chair, thanks.